That's a really important question. And I try to draw out that distinction in my book a little bit. I know that there have been some really fantastic efforts to move the country to value, some really great initiatives, terrific, very interesting pilot projects that came out of the Innovation Center at CMS. So I want to say that I really applaud a lot of the effort. But as your question kind of hints, we probably haven't seen the full transformation, the full impact of those programs as much as we would have liked to have seen. And in large part, that is due to what I alluded to earlier, which is that I think that especially health systems and I'm going to call out physicians particularly among them, have figured out ways to, in some cases, to improve quality, and in other cases, maybe to game the system just a little bit. Whether it's, thinking about how we code different patients, there are all kinds of ways. Which is why I think it's so vital that we have tools, that we make, a colleague of mine, Vindell Washington, likes to say, we need to make the right thing the easy thing to do. And that typically we apply it to patients, making the healthier way of living the easier way of doing it. But I think it also applies to physicians. We need to make the right thing the easy thing to do for physicians and health systems in terms of how they can deliver on value. So that value isn't just a matter of ticking off some boxes, but value is really kind of a completely different mindset for being evaluated on the outcomes of our patients against the costs of the care and ensuring their patient engagement and access to care. So I think we need to make those tools for everyone to be successful. We need to make tools for clinicians, for patients, because they're a critical, absolutely critical part of this whole narrative, as we talked about in the whole journey. Patients and clinicians need to co-produce, need to work together, and payers as well. I think that everyone, I'm sure most people feel the conclusion is that we've definitely underinvested in public health. There have been a number of studies that have looked at the decline of investment in public health in this country and compared us also with other developed nations around the world. So there's no question that we've been underinvested. But it's not just about the investment, it's also about the coordination between public health authorities at the local level, local county level, at the state level, and at the federal level. And I think we've seen a lot of that disconnect play out during the pandemic, and the need to create more collaborative models of communication and of data and data sharing. I think those are actually really, really important. I think, if anything, the crisis has further reinforced some of these key principles that I think I write about a lot in the long fix, but just generally feel that, for example, that it's really critical that people are able to co-produce their own health outside of the four walls of their hospitals and clinics, that they have the tools to do so, and that in many cases, digital tools can really accelerate that. Whether it's sensors and home monitoring devices, or self-testing, for example. We saw that with COVID testing, people could just do the swabs themselves, for example, or enabling them to have the information about what things that they ate might affect their blood sugars the most or contribute to their weight gains the most, that might be different from other people. Everybody's metabolism is a little bit different. So how do we enable people to manage their own health in a proactive way that's really in a personalized experience? How do we give the right tools to the clinicians and to the payers that they can support that, so that they will either cover the costs of the telehealth or the sensors and devices that are necessary, or if they're the case of the clinician, how do they actually work together with the patient in that kind of relationship that's very different from just relying on them coming into the clinic, 10 or 20 minutes, 6 months, every 6 months or every year. So it does require kind of a change in how we need to think about healthcare, and also how we need to pay for healthcare. But I think, if anything, the pandemic has shown that, I called the book The Long Fix because it was written before COVID. Now I guess I would say it's definitely going to be a quicker fix. It has to be. because I think we all see the urgency of it, whether it's from the public health perspective or primary care and preventative care and beyond.